Good morning, everyone. I'm introducing my topic about COVID-19. First, problem to be addressed within the multifaceted effects that COVID-19 pandemic has broken open our society. It's critical to recognize that despite the universal nature of COVID-19 economic impact, some social groups have been affected more adversely. Among them children, essential workers, and the elderly serve an exemplary figure. With lockdown around the world and restrictions on movement related on the uh, coronavirus pandemic, children are far away from family, friends, classroom, and play, which is causing many problems. The isolation over a long span of time causes profound instability in the physiological and emotional state of children. Meanwhile, the older, most vulnerable to the severe fall of the disease, have suffered significantly from the pandemic, reporting drastically increased mortality. The increase in mortality rate will lead to the negative population growth of the country, which will lead to the increase of patient medical and social welfare expenditure in the future. On the other hand, key workers who are on the extreme end of the battle due to the pandemic face increased chance of harboring physical and mental health risk. Well, striving to explain this complex phenomenon on this discussion, we must all try to find the ways to achieve the equal and considerate approach to all people participating in the society. Second, this is about data. Furthermore, as evidence unfolds, it's clear that this matter is far more serious than media reports have been suggesting. The situation in the United Kingdom alone has been dead, with over 4 million deaths registered among the elderly population above 65 years of age. This presents the fact that the elderly population is highly susceptible to the pandemic. It also means that the government need to spend more on protecting the health of older people, such as build more hospital and buy more medical equipment and so on. The other daunting statistic to emerge from the pandemic is the distribution of education for 463 million children around the world. The impact of COVID-19 on the education system has further uh, exacerbated uh, educational inequality, with children living in poor or rural areas having significantly reduced access to education. The impact of distributed education on students is not only missing out on school, but also requiring parents to spend more time and money to take care of their children, which is very difficult during the pandemic. This dark statistic not only reflects the current learning impact but also alludes to future consequences for the society and its justice and development agents. In addition, the truth that treating the essential workers cannot be ignored, as over 15% of them are constantly uh, subject to the COVID-19 threat daily. The inability of workers to work in the face of the pandemic has led to the country's economic uh, stagnation. These numbers together tell a great and unambiguous story of how COVID-19 continue to devastatingly affect our most vulnerable population, and why society should mobilize and address this effect as soon as possible. Third, why the problem exists. As we proceed in our discussions of these great challenges and delve deeper into in root causes, it's no longer a secret that systemic weakness only add to the uh, disruptive consequences of the pandemic. The lack of adequate healthcare resources among the elderly, coupled with their vulnerability, thus leading to disproportionate exploiting the effect of the virus. It's not as if uh, legislation does not fall short in certain areas or technology is not so uh, ready available to our children and our essential workers. Inadequate legal farmer workers depict the necessary supporting structure for effective pandemic measures. The digital divide further deepens the gap between those who are already experiencing the uh, repercussion of social and economic disparity without changes in broad policy aimed at preventing systemic inequalities. This cycle of society divisions will repeat and inequality will be exacerbated. Therefore, we must not hesitate to make sweeping structural changes and pass in crucial uh, policies aimed at eliminating these inequalities in order to shape a climate-friendly and just world for everyone. This group requires the uttermost concentration because they are not only vulnerable but also very important for the present and the future of this country. About policy response. In order to move forward toward the better future that is promised by the post-pandemic pandemic world, there is no doubt that multi-pronged protective plan of action is absolutely critical to combat the effects of pandemic. One of the most important priorities in this response have to be improved healthcare and especially in the care of the elderly since this community has been susceptible to these virus attacks. On the other hand, it's important that the government take the steps necessary to ensure that there are adequate laws in place to push for enforcement of measures geared toward promoting health and safety. In addition, as a result of acknowledgement of the significance of education in defining our future, investing into the application of technology that would help people to study remotely and to tackle the digital divide is more important than ever. This strategic innovations, if carried out, will help balance the negative impact of the pandemic to the most affected and uh, disadvantaged individuals and ensure access to healthcare and education, especially to the most vulnerable, as well as creating a more resilient society that is ready to uh, withstand or overcome such challenges. By working hard and close cooperation, we have a chance to come out of this harriet and even stronger and uh, more united country. I would like to urge the government to put more resource on this group and concentrate on prioritizing on the policies about the policy prioritization. Therefore, in the wake of discussing the most significant issue to be put forward when addressing the pandemic is clear that greater emphasis need to be placed on the needs of aging population and improve healthcare infrastructure and to ensure that said population is secure. The impact, however, uh, is not limited to the needs of this economically secure sector of society, and rather these strategies have a positive impact on other parts of the population as well. From a public health perspective, by building such strong health care infrastructure that is specially designed for the elderly. We achieve the aim of not only providing them with health protection, but also contain the transmission of disease in the community. In addition, investment in the healthcare need of the elderly allow for the establishment preventive measures to curb the overabundance of our resources that are usually channeled to treat children and other essential workers who get sick from uh, continuously being at work. Moreover, the choice of the elderly population would protect the wood from present and the value of generations. What's more, this shift in the focus toward building up healthcare infrastructure match well with the overall effect on investing on technology and implementing regulations in general. In providing such choice, such uh, cohesive policy with unique elements capable of connecting these issues together, a more robust and fairer world become possible. By doing so, there are the immediate event of the pandemic as well as shaping a society that can withstand and withstand the challenges of any future crisis. Indeed, it's time that we all came together and agree that supporting our children is not just a good deed for the sake of the children, but a good deed for the sake of tomorrow, and that is good seed that uh, cultivate a better tomorrow. This is my reference. That's all. Thank you.